What if your kidneys were slowly losing function, and you didn't even know it? It may sound surprising, but chronic kidney disease often develops quietly over many years. In its early stages, many people feel completely normal. By the time obvious symptoms appear, significant kidney damage may already have occurred. That's why kidney disease is often called a silent condition. The good news is that your body may give you subtle warning signs before serious problems develop. Recognizing these signs early and seeking medical advice can make a real difference. In today's video, we'll discuss 8 silent warning signs that your kidneys may be in trouble, explain why they happen, and share simple steps that may help support your kidney health as you age. Be sure to watch until the end, because our number 1 warning sign is something millions of older adults experience every day, and many assume it's simply a normal part of getting older. Let's get started. Your kidneys are 2 bin-shaped organs located just below your rib cage on either side of your spine. Although they're only about the size of your fist, they perform some of the most important jobs in your body. Every single day, your kidneys filter waste products from your blood, remove excess fluid through urine, help regulate blood pressure, balance important minerals such as sodium and potassium, support healthy red blood cell production, help maintain healthy bones through vitamin D activation. Your kidneys work around the clock, often without you ever thinking about them. Unfortunately, several common conditions become more frequent after age 60 and can increase the risk of kidney disease. These include high blood pressure, type 2 diabetes, heart disease, obesity, smoking, a family history of kidney disease, long-term use of certain pain medications, especially nonsteroidal anti-inflammatory drugs, NSAIDs. Having one or more of these risk factors doesn't mean you'll develop kidney disease. It simply means regular checkups become even more important. Now let's begin our countdown. One of the earliest warning signs that something may be affecting your kidneys is a change in your normal urination pattern. Since your kidneys produce urine, changes in how often you urinate, or what your urine looks like, can sometimes provide important clues. Some changes to pay attention to include urinating much more often than usual, urinating much less than usual, frequently waking during the night to urinate, foamy or bubbly urine that doesn't quickly disappear, blood in the urine, difficulty passing urine, feeling an urgent need to urinate more often. Now, it's important to remember that these symptoms can have many causes. For example, urinary tract infections, enlarged prostate in men, certain medications, increased fluid intake, diabetes, bladder conditions. That's why changes in urination should never be used to diagnose kidney disease on their own. However, if these changes persist or are accompanied by pain, fever, swelling, or blood in the urine, they deserve prompt medical evaluation. Your healthcare provider may recommend a urine test, blood tests to measure kidney function, blood pressure measurement, imaging studies if needed. Early evaluation often leads to better outcomes. Have you noticed that your shoes suddenly feel tighter? Or perhaps your socks leave deep marks around your ankles. Persistent swelling, especially in the feet, ankles, lower legs, hands, around the eyes, can sometimes occur when the kidneys aren't removing excess fluid as effectively as they should. When kidney function declines, the body may retain more salt and water. This extra fluid can collect in the tissues, leading to swelling. However, kidney disease is only one possible cause. Swelling may also result from heart disease, liver disease, certain medications, problems with the veins or lymphatic system, long periods of sitting or standing. That's why it's important not to ignore persistent swelling, particularly if it develops suddenly or is accompanied by shortness of breath, chest discomfort, Rapid weight gain. Reduced urination. These symptoms require prompt medical attention. If swelling continues for several days or keeps returning, schedule an appointment with your healthcare provider. Simple blood and urine tests can help determine whether your kidneys may be involved. Everyone feels tired from time to time. But if you're getting enough sleep and still feel exhausted almost every day, it's worth paying attention. Persistent fatigue is a common symptom with many possible causes, including poor sleep, depression, thyroid disorders, heart disease, vitamin deficiencies, anemia, chronic infections. Kidney disease can also contribute to fatigue. One reason is that healthy kidneys produce a hormone called erythropoietin, which helps your body make red blood cells. If kidney function declines, your body may produce less of this hormone. Over time, this can contribute to anemia, meaning your blood carries less oxygen throughout the body. The result may include low energy, weakness, difficulty concentrating, reduced exercise tolerance, feeling tired even after resting. Another possible reason is that waste products may build up in the blood when kidney function is significantly reduced. This can leave people feeling generally unwell. Of course, fatigue alone doesn't mean you have kidney disease. But if tiredness is persistent, unexplained, or accompanied by other symptoms on today's list, it's a good idea to speak with your healthcare provider. Sometimes a simple blood test can identify the underlying cause. One of the biggest challenges with kidney disease is that it often develops gradually. Many people don't notice obvious symptoms until kidney function has already declined. That's why regular health checkups become increasingly important after age 60, especially if you have diabetes, high blood pressure, heart disease, or a family history of kidney problems. Routine blood and urine tests can often detect changes long before you would notice symptoms yourself. Finding kidney disease early gives you and your healthcare team more opportunities to slow its progression through lifestyle changes, medication when appropriate, and careful monitoring. So far, we've discussed 3 important warning signs that should never be ignored. 8. Changes in urination. 7. Persistent swelling. 6. Constant fatigue. Remember, none of these symptoms automatically mean you have kidney disease. Many medical conditions can cause similar problems. However, when these symptoms persist or occur together, they deserve proper medical evaluation. Now let's continue with the next 4 warning signs. Have you ever looked at your favorite meal and simply had no interest in eating it? Or perhaps you've noticed a persistent feeling of nausea that doesn't seem to have an obvious cause. While occasional nausea or a poor appetite can happen to anyone, ongoing symptoms shouldn't be ignored. As kidney function declines significantly, waste products that are normally filtered from the blood may begin to build up. This can affect the digestive system and contribute to symptoms such as loss of appetite, feeling full very quickly, nausea, occasional vomiting, a metallic taste in the mouth, food tasting different than usual, unintentional weight loss. Many people initially blame these symptoms on aging, stress, or a minor stomach problem. However, if your appetite continues to decline for several weeks or you're losing weight without trying, it's important to speak with your healthcare provider. These symptoms can also be caused by digestive disorders, liver disease, certain medications, infections, depression, cancer, other chronic illnesses. The key message is simple: persistent appetite changes deserve investigation. Maintaining good nutrition is especially important as we age. Your body needs enough protein, vitamins, minerals, and calories to maintain muscle strength, immune function, and overall health. If eating becomes difficult because of nausea or poor appetite, early medical advice can help identify the cause and prevent further health problems. Many people notice that their skin becomes drier with age. That's perfectly normal. However, persistent itching or unusually dry skin that doesn't improve with moisturizers may sometimes signal an underlying medical problem. Healthy kidneys help maintain the balance of minerals and nutrients in your body. When kidney function becomes significantly impaired, changes in these balances can contribute to skin problems. Some people experience persistent itching, dry, flaky skin, skin irritation without a visible rash, difficulty sleeping because of itching. The itching may affect the arms, legs, back, chest, or even the entire body. Of course, dry skin has many other possible causes, including cold weather, low humidity, allergies, eczema, certain soaps, dehydration, diabetes, liver disease. That's why skin changes alone don't diagnose kidney disease. However, if severe itching continues despite good skin care, or appears together with swelling, fatigue, appetite loss, or changes in urination, it deserves medical attention. Simple blood and urine tests can help determine whether kidney function should be evaluated. Have you ever been awakened in the middle of the night by a painful leg cramp? Muscle cramps become more common as we get older, but frequent or severe cramps can sometimes point to an underlying health issue. Healthy kidneys help regulate important electrolytes, including sodium, potassium, calcium, magnesium. These minerals are essential for normal muscle function. When electrolyte levels become imbalanced, muscles may contract unexpectedly, leading to painful cramps. People with kidney disease may experience cramps in calves, feet, toes, hands, thighs. However, kidney disease isn't the only explanation. Muscle cramps may also result from dehydration, overexercising, certain medications, poor circulation, nerve disorders, vitamin deficiencies. To help reduce ordinary muscle cramps, many people benefit from drinking enough fluids, unless advised otherwise, gentle stretching before bed, staying physically active, eating a balanced diet. If cramps are frequent, severe, or occur alongside other warning signs from today's video, discuss them with your healthcare provider. They may recommend blood tests to check electrolyte levels and evaluate kidney function. This next warning sign is especially important. Shortness of breath should never be ignored. Healthy kidneys help maintain the body's fluid balance. When kidney function is significantly reduced, excess fluid may build up. In some situations, this extra fluid can contribute to breathlessness. Another possible reason involves anemia. As we mentioned earlier, healthy kidneys produce a hormone that helps your body make red blood cells. If fewer red blood cells are available to carry oxygen, everyday activities may leave you feeling unusually breathless. You might notice symptoms such as becoming winded while walking, difficulty climbing stairs, feeling short of breath during light activity, needing to stop and rest more often than usual. However, it's extremely important to remember that shortness of breath has many possible causes, including heart disease, asthma, chronic obstructive pulmonary disease, COPD, lung infections, blood clots, anemia unrelated to kidney disease. Because some of these conditions can become serious very quickly, you should seek prompt medical attention if you develop sudden or severe shortness of breath, chest pain, blue lips or fingertips, confusion, difficulty speaking because of breathlessness. These symptoms require urgent evaluation. Never assume shortness of breath is simply part of getting older. Have you noticed something about today's warning signs? None of them are unique to kidney disease. That's exactly why kidney disease can be difficult to recognize. Symptoms such as fatigue, dry skin, nausea, swelling, or muscle cramps are common and may be caused by many different medical conditions. The important point isn't to diagnose yourself. It's to recognize persistent changes in your health and seek medical advice rather than ignoring them. Healthcare professionals can use blood tests, urine tests, blood pressure measurements, medical history, physical examination, to determine what's causing your symptoms. Early diagnosis often provides the greatest opportunity to protect kidney function and overall health. So far, we've discussed 7 silent warning signs that may indicate your kidneys need medical attention. 8. Changes in urination. 7. Persistent swelling. 6. Constant fatigue. 5. Loss of appetite or nausea. 4. Dry, itchy skin. 3. Muscle cramps. 2. Shortness of breath. Now it's time for our number 1 warning sign. This final sign is especially important because it's both a major risk factor for kidney disease and a possible consequence of kidney problems. Let's take a closer look. High blood pressure, also called hypertension, is often known as the silent killer because it usually causes no obvious symptoms. Many people feel completely well, even when their blood pressure is dangerously high. What many people don't realize is that the relationship between blood pressure and your kidneys works in both directions. Your kidneys contain millions of tiny blood vessels that filter waste from your blood. Over time, uncontrolled high blood pressure can damage these delicate blood vessels, making it harder for your kidneys to do their job. As kidney function declines, waste products and excess fluid may begin to build up in the body. The relationship also works the other way around. When the kidneys become damaged, they may struggle to regulate fluid balance and hormones involved in blood pressure control. As a result, blood pressure may rise even further. This creates a cycle in which high blood pressure damages the kidneys, and damaged kidneys make blood pressure more difficult to control. That's why managing blood pressure is one of the most important steps you can take to protect your kidneys. If you're over 60, especially if you have diabetes, heart disease, or a family history of kidney disease, your healthcare provider may recommend regular blood pressure checks. Many people also monitor their blood pressure at home using an automatic blood pressure monitor. Keeping a simple record of your readings can help your healthcare provider identify trends and adjust treatment if necessary. If your blood pressure remains high despite taking medication as prescribed, don't ignore it. Speak with your healthcare provider. Sometimes treatment plans need to be adjusted, and addressing the problem early may help reduce the risk of kidney damage. Now that we've covered the warning signs, let's finish with practical habits that may support kidney health over the long term. Your kidneys need enough fluid to help remove waste from the body. For many healthy adults, drinking water regularly throughout the day is a good habit. However, fluid needs vary. If you've been told to limit fluids because of kidney disease, heart failure, or another medical condition, always follow your healthcare provider's advice. Because high blood pressure is one of the leading causes of kidney disease, managing it is essential. Helpful habits include limiting excess sodium, staying physically active, taking medications as prescribed, maintaining a healthy weight, attending regular medical checkups. Even small improvements can make a meaningful difference over time. If you have diabetes, keeping your blood sugar within your target range can help reduce the risk of kidney damage. Work with your healthcare provider to monitor your blood sugar, follow your meal plan, and take medications as directed. Focus on foods such as fruits, vegetables, whole grains, beans and legumes, healthy fats, lean protein sources. Try to limit highly processed foods, excess sodium, sugary drinks, frequent fast food meals. Healthy eating supports not only your kidneys but also your heart and overall well-being. Regular exercise supports healthy circulation, blood pressure control, blood sugar management, weight management. You don't need intense workouts. Walking, swimming, cycling, gardening, or chair exercises can all be excellent choices depending on your ability and health status. Aim for consistency rather than perfection. Smoking damages blood vessels throughout the body, including those that supply the kidneys. If you smoke, quitting is one of the best things you can do for your health. Also, use over-the-counter pain relievers carefully. Frequent or long-term use of certain nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen or naproxen, may increase the risk of kidney problems in some people. Always follow the instructions on the label and speak with your healthcare provider if you need pain relief regularly. One of the best ways to protect your kidneys is to identify problems early. Your healthcare provider may recommend blood tests to measure kidney function, urine tests to check for protein, blood pressure monitoring, diabetes screening. These simple tests can often detect kidney disease before symptoms become obvious. Early treatment may help slow disease progression and reduce the risk of complications. Let's quickly review today's 8 silent warning signs. 8. Changes in urination. Pay attention to persistent changes in frequency, appearance, or difficulty passing urine. 7. Persistent swelling. Swelling in the feet, ankles, hands, or around the eyes deserves medical evaluation if it continues. 6. Constant fatigue. Ongoing tiredness may have many causes, including anemia associated with kidney disease. 5. Loss of appetite or nausea. Persistent digestive symptoms shouldn't be ignored. 4. Dry, itchy skin. Skin changes may sometimes reflect underlying medical problems. 3. Muscle cramps. Frequent cramps can occur for many reasons, including electrolyte imbalances. 2. Shortness of breath. Always seek prompt medical attention for sudden or severe breathing difficulties. 1. High blood pressure that is difficult to control. One of the most important warning signs and risk factors for kidney disease. Remember, these symptoms do not automatically mean you have kidney disease. Many other conditions can cause similar signs. The purpose of today's video is not to diagnose illness but to encourage early medical evaluation when persistent symptoms occur. The earlier kidney disease is identified, the more opportunities there may be to slow its progression and protect your long-term health. If you found today's video helpful, please give it a thumbs up and subscribe to our channel. Every week, we share evidence-based videos on kidney health, heart health, diabetes, brain health, healthy aging, nutrition after 60, medication safety. Our goal is to help you make informed health decisions using reliable, easy-to-understand information. Now we'd like to hear from you. Which warning sign surprised you the most? Was it changes in urination? Swelling? Fatigue? Muscle cramps? Or high blood pressure? Leave your answer in the comments below. And if you know someone over 60 who could benefit from learning these warning signs, please share this video with them. You could help someone recognize an important health issue earlier. Thank you for watching, and we'll see you in our next video.